Hello friends, welcome back to my channel ICU Corner. Myself Dr. Kiran Jadhav, ICU intensivist. Today we are discussing about a new topic, GCS, that is Glasgow Coma Scale. Excited? Many a times routinely we use this term GCS or hear this term in the ICU regarding the neurological status of the patient, that what is the GCS of this patient and what is the plan for further plan for that patient. So GCS, it helps to assess the neurological status of the patient, that is the conscious level, what is the conscious level of the patient. So according to GCS we further plan the treatment plan, that is whether we have to intubate this patient and ventilate to secure his airway if the GCS is lower than 9. So GCS is measured, the total score of the GCS is 15 and the lowest score is 3. If the GCS is between 3 to 8, we must have to intubate this patient and ventilate him as the GCS is very poor. So in GCS we measure the GCS in 3 aspects mainly, that is the eye response, second is the verbal response, and third is the motor response. So accordingly we give a scoring. For eye response, the total score is 4. For verbal response, the total score is 5. And the motor response, the total score is 6. That is 4, 5 and 6. E, V, M. E4, V5 and M6. The total becomes 15. So GCS is measured out of 15. So in eye response, we check for the eye response of the patient. Firstly, if the patient is spontaneously opening his eyes to the verbal commands and he is fully conscious and oriented and opening his eyes spontaneously, so we give score 4. When the patient patient open his eyes to the verbal command, when we ask him or her to open his eyes, then at that time we give a scoring of 3. Second one, when the patient open his eyes to the painful stimulus, and we at that time we give score 2. And when there is no response, not to any pain or to the verbal command, then we give score 1. So understood, there are four scores to the eye response. Spontaneously opening his eyes, 4. Opening his eyes to the verbal, to the speech, 3. Opening his eyes to the pain stimuli, 2. And there is no response, scoring is 1. Another aspect is a verbal response. So if the patient is fully conscious, oriented to the time, person and place, if you ask the patient what is the time now, he gives the answer properly. He recognizes the person, and he also tells us correctly what is at which place he is now, whether he is in a hospital or at his home. So he recognizes properly and answers them properly. So at that time, for this verbal response, for fully awake patient, we give score 5. So while getting this verbal response, we must ask these questions. That's what is your name, where you are, and what is the time now. Okay. So when he answers correctly, we must give a score of 5. If he is confused while answering, we must give scoring of 4. If he answers but in inappropriate words, we must give scoring of 3. When he answered this question, but in incomprehensible sound, that we can't able to recognize understand what he is talking about, and we must give a scoring of 2. And when there is no at all response, we give a score 1. So there is total 5 scores to the verbal response, that is when he is fully awake and conscious, to time, place and person. Then he is fully oriented, score 5. He is confused, score 4. He is giving answer but in inappropriate words, score 3. He is giving answer but incomprehensible sound, where that we can't able to recognize what he is talking about, it is score 2. And when there is no at all response, that is score 1. The last aspect is motor response. There is total 6 scores in motor response. When we ask patient to lift his hand, to grip, to hold our hand and grip it tightly, when he responds properly, obeys the commands, it is we give him score 6 to the motor response. When we give a painful stimulus, for example, we give a painful stimulus to the trapezius muscle, and he localizes the pain. He takes his hand over it and he localizes the pain and moves his arm towards that painful stimulus, and we give a score of 5. When he flex and withdraws from the pain, when he flexes his arm and he withdraws from the pain but doesn't localizes the pain, then we give a score of 4. Next one, when there is abnormal flexion, when we give a painful stimulus here and his hand is just flexed abnormally, that is abnormal flexion, then we give a score of 3. And another one, when there is abnormal extension, when he can't able to flex the arms, and when we give a painful stimulus and there is an extension of that arm, we also called it decerebrates response. Then we give a scoring of 2. And last one, when there is no response to any painful stimulus, at least we should give at least painful stimulus for at least 10 seconds and to get the response. When there is no at all response, and we give a last score 1 to the motor response. So there are total 6 scores for the motor response. While writing the GCS, we should write it down in 3 capital letters, that is E, V and M, and accordingly with it its scoring. That is, patient is fully awake, he is opening his eyes spontaneously, he is oriented to time, person and place, and he obeys all the commands. So the GCS is 15. GCS is 15 by 15. We should write it as E4, V5 and M6 is equal to GCS is 15 by 15. And accordingly, when the patient response is not good, so accordingly we should give him the scoring. So the severe score is between 3 to 8. In this severe scoring, GCS scoring, we should intubate the patient, secure his airway and prevent him from aspiration. When the scoring is between 9 to 12, it is a moderate score. We must observe the patient closely for his neurological status, whether he may need intubation, or accordingly if he improves, then the score will improve above 13, about 12, and the score, it is a mild deteriorated GCS, that is score is between, when the score is between 13 to 15. 15 is normal score, patient is fully conscious, awake, alert. So GCS is very important tool, assessment tool for the neurological status of the patient in the ICU. Everyone must know how to use this tool. So please learn it properly and implement it in your practice in the ICU. So that's all for today. We'll see you in the next video. Till then, goodbye. Thank you.